District level program, 20 districts of Odisha, where we conducted almost 15 rounds in the district level approach. Now, after 22-23, we went beyond district to block level. Maybe the time will come, we have to go for the subcenter level, which are the subcenter where the aggregation of cases are there. Like the Dr. Datta was showing the red map of Odisha as far as microfilaria rate is concerned. Each block needs to identify two sites, one sentinel, one random. Sentinel based on the coverage compliance and based on the morbidity load. Whereas I hope every district is changing bit maybe February 2024 or August 2024. Every district is changing the random site every year. So in August 24 round for 11 districts, 197 IUs were conducted NBS. In 2022-23, we conducted 2.4 lakh testing. In 2024 round of August, we conducted 1 lakh 2,900, which 1 lakh plus slides were collected. So I will definitely congratulate you all to take the efforts for collection of these 1 lakh plus slides from 11 districts. Out of that, 2,652 negative, that is 2%, but is our role, and 702 positive slides. So last year, if you see the February round and August round, around 900 plus positive were detected. Out of that, 11 districts, the counterpart were 700 positive, MF positive were detected, and 2,600 we have examined the 2% negative slide. This examination of around 3,000 plus slides conducted by RD office Bhubaneswar as well as the NCDC headquarters and NCDC Rajamundi. So definitely national level institutions are also taking part in Odisha cross-checking, and this is the only state where the national level laboratories are involved for the cross-checking apart from the regional level laboratories because of the shortage of manpower with us. And after cross-checking, last year we conducted in 11 district 197 IUs. Out of that, 75 IUs were showing more than 1% MF rate in any site. So for us, one IU is a one block, two sites. So any site, if it is showing more than 1%, then we are taking the decision to continue the microfilaria MDA in that IU is instead of going into the pre-TAS and TAS phase. So total 14 discrepancy out of that 3,000 plus slides we examined. We found during the cross-checking by different agency at the Government of India level. Out of these discrepancies, the false negative was 8, means patient was given the negative, but it was a positive. So that is a more eye-opener that still we require the reorientation, persuasion at the lab technician level, because if we would not have done the cross-checking of these 2% negative slide, these people of 8 numbers, they will be harboring the microfilaria, they will be transmitting the disease, and after 10 to 14, 15 years of duration, they will be land up into morbidity. The gift was given by us because of our wrong diagnosis. Second, the positive was false positive was 6, so it will not cause any harm. But false negative, definitely it is a harm, and that too it is a proportion of only 2% slides which we have examined. So the rest liability goes to remaining 8% which the state needs to cross check, and then given the discrepancy rate at par, because the technician is same who is examining this 2%, who is examining this remaining 8%. So we expect that same 8% will give 0.36% discrepancy rate. So we have to see that data also. I will request Dr. Mohanty and Dr. Sahu sir, please see your data of 8%, just like the 2% of our data for the negative slide. And I will request the district who are having the remaining 90% negative slide to verify which are these technicians who are having 2%, 0.36% false negative. Maybe in 90% you are having much more than that, and these are the people who are MF positive, who are the carrier, who are responsible for the transmission and who may land up into the deformity level. Then many of the districts has received more than 15 rounds of MDA. We know Anmol, Jharsuguda, Denkanal, Ganjam and Jajpur are sitting here. So these blocks, if they are showing sizable number of sites showing more than 1%, it is a concern. Because if you see the journey of Odisha for lymphatic filariasis and MDA, we started in 1960s. We started MDA in 2004. The first MDA in India conducted in Ganjam in 96-97. So we are the beginner for the MDA, and we are still continuing Ganjam since 1996 to 2000.